My name is Dr. Chukwu, consultant gynecologist with Princess Lady Clinics. We'll be discussing an overview of assisted reproductive technology, which is a topic that has become very familiar with a lot of people because of so many people in Nigeria are grappling with the issue of infertility. So you find that infertility has become much more common than several years ago. The reason is because a lot of people, especially women, they want to pursue their profession, they want to do some programs, and a lot of them, even those who are married, you find couples trying to defer their child bearing. They want to say, okay, let's get married, but we won't start making babies until 5 years. I want to finish my master's, I want to finish my doctorate. And as a result of that, you have so many people coming, especially women, when they are already in their late 30s. And you still get a significant number of people coming in early 40s. And at this time, you know that in terms of reproduction, their reproductive capability is already winding up. So this is one of the major contributors to the problem of infertility we are having. So the other areas we have problem is problem with previous experiences that young women had in their younger age, coming back to haunt them. Okay, those who have had abortions, procedures that will compromise their reproductive choice, coming back to haunt them in their later years. So you see all these group of people are grappling with the issue of infertility. And then among our men too, especially those of them who work with the oil companies and they expose themselves to some adverse conditions, coming down with a problem with male factor infertility. So all these join to contribute to the problem of infertility that we are having. And this is where Princess Lady Clinics have come in to try to solve problems that couples are grappling in the area of infertility. And we are starting our IVF program. We'll be looking at all this. So generally, you find that so many women are unaware of the fact that age affects the ability of a woman to reproduce. So there is an extent to which you can defer your reproductive career. You are in your late 30s. You are either not married or you are married and you are not yet ready to make babies. You are one of the candidates that will likely have problems with childbearing much later in the future, because the eggs that women have are numbered, okay, and they age just as the woman ages herself, and they can be depleted. So as a result, you see women having problem having spontaneous conception. Now, what is assisted reproductive technology? So assisted reproductive technology speaks to, procedures and programs that we do to help a woman or a couple to achieve pregnancy, which involves the handling of the gametes. So when the caregivers or the reproductive health experts will have to do something that will involve handling of the gametes, the eggs, the spermatozoa, then that is a form of assisted reproduction. And there are different forms of assisted reproduction that you can have. But what determines the type of assisted reproduction that you have will be the result of the investigations. You have to first of all come, to be evaluated from asking you questions which we call history taking, to examining you to find out if there are problems that we can find from general physical examination or gynecological examination. If there are things we can find, and then thereafter we do a few investigations that will help us to understand what is happening in your body. It is when we are done with all this that we'll actually find out what exactly is wrong with the couple, with the woman and the husband, and then we will know what form of treatment we will provide for the couple. So, why will someone have assisted reproduction? Why will someone need assistance? So I've already mentioned some of the problems. You'll find that for a young lady, maybe the fallopian tubes are blocked. Because for a woman to get pregnant, you have to meet with a man who will put sperm in your body, and the sperm is supposed to move through your body, pass through the fallopian tube, okay, to get to where the egg will be waiting for it. The egg as well, which we call the follicles, will be released at the end of a woman's cycle or somewhere in the cycle, usually around the middle of the woman's cycle. At least one egg will be released, and it will pass through the distal opening of the fallopian tube, which we call the fimbrial end, into the fallopian tube to wait at the point where we call ampulla of the fallopian tube, the ampullary region. And that is the point where the sperm will come and meet it, fertilize it, and then the fertilized egg will go back into the womb to get implanted and start growing. So where you have this fallopian tube blocked and the blockage happens on the two sides, you find that it is not possible for the egg and the sperm to meet. And so no matter how vibrant the man is, no matter how young the woman is, okay, fertility or conception will not be possible because there is a blockage. So the other thing is that sometimes you find that the man's sperm has abnormalities. This sperm, we expect the sperm to get to a certain number to be able to result in fertility. So you find that some people have too few number of sperms, in their ejaculate. So it's fewer than is required for conception to take place. Again, the other thing we look at, apart from the numbers, is the quality of the sperm. We want the sperm to be motile. The sperm should be able to move from where it is deposited to where it's supposed to meet the egg for fertilization. So sometimes you find that in the whole sperm, just about a few percentage of the spermatozoa are motile. So that kind of sperm parameter will not be enough to result in fertilization. In fact, some you'll find that almost 100% of the sperm are dead for a lot of reasons. So for such people, you will not be able to achieve spontaneous conception. So what IVF or assisted reproduction will do for them is to be able to collect these spermatozoa, process them and collect the vibrant ones, the active ones, the good ones among them, use it to fertilize the egg and then implant it in the woman's womb. Okay, but of course, before you get to IVF, of course, there are other simpler procedures that we can do for people who are having these challenges. So we've mentioned the problem of the fallopian tubes being blocked. We've mentioned the problem of the sperms not being good, or sometimes there may not even be sperm at all in a young active man. When the man produces an ejaculate, you find out that there's no sperm, it's just water, ordinary plain fluid that has been ejaculated. Such people may need to do other procedures to be able to achieve conception for them. There are several options that we can use to help them achieve conception. Then, of course, sometimes you also find that some people are just okay. They're okay, and then for one reason or the other, or for no reason, you find that they are unable to achieve conception. So for such people, they have stayed for so long, they are okay, they have done all the tests and everything is fine, and they cannot get, they cannot achieve conception. So we also offer them some form of assisted reproduction, depending on their capacity and what they can bear in terms of cost. So we can do intrauterine insemination for them, or they may even go straight ahead to do IVF. So some of the assisted reproductions will include intrauterine insemination. So this one, most people, some of our colleagues think that there's not much assistance in it, so it may not qualify as a form of assisted reproduction. But of course, there is some form of assisted reproduction. You are handling just one of the gametes. You are not handling the eggs. You are handling the sperms. So in this case, what you do is you prepare the man's sperm, get the best out of this sperm, isolate them, and then put it in inside the woman's womb at the right time, so that it can go and meet up with the egg that you expect to be waiting there already. So this is what we do in intrauterine insemination. You just actually just prepare the spermatozoa, concentrate it, make sure the dead ones are removed, the abnormal ones are removed, and then the good ones are concentrated, and then they are inseminated into the woman. And then the rest will just go like as normal conception. So the only thing you are doing is that you are taking the sperm and then you are transporting it to where it is supposed to be. And then you allow the natural process to complete the rest. That's what is done in intrauterine insemination. So the other form will be IVF, okay, which means in vitro fertilization, where you prepare the woman to produce as many eggs as possible, and then you harvest these eggs from the woman. The ones that are good, you take the man's sperm, fertilize these eggs, and then incubate them, allow them to grow and see evidence that fertilization has happened and that the embryo is developing well. And then at a certain stage in the embryo development, you will pick those embryos and then put it back inside the woman's womb. And then the embryo will implant and start developing as a normal pregnancy. See, sometimes the woman may even have remaining embryos or even remaining eggs, okay, which can be frozen. You can freeze the embryo or freeze the egg and keep. You can also freeze the sperm, of course, and keep it at a later time. They will just come, you prepare the woman's womb, and then implant and transfer the frozen embryo. So we call it frozen cycle, frozen embryo cycle, okay, or frozen embryo transfer. So that is what can be done. But again, for people who have severe male factor infertility, where the man has just a few sperm, or maybe the sperms are not even good. So what you do is that you try to isolate the best of these spermatozoa and then pick them. Instead of just putting it around the egg so they can fertilize the egg on their own, you just pick the embryo itself and inject it into the egg. Okay, so this is what we call intracytoplasmic sperm injection. You inject it and then you await fertilization, evidence that fertilization has happened, and then you go on and incubate and then also transfer at the appropriate time. This is what you do. But for some men, they are not able to ejaculate sperm at all. So when you look at their ejaculate, there is no even a single sperm inside. So what do we do for these people? We offer surgical sperm collection, whereby you collect, you either aspirate, sperm directly from the epididymis or the testis of the man. Okay, find good ones from inside the ones you aspirate directly, from the man. You extract it and then you use it to fertilize the wife's egg. So this has been done and then it has led to a lot of live births. So this is one way you can get achieve conception for a couple who are grappling with these problems. So we call this surgical sperm collection. So which you either do either from the epididymis or directly from the testes. So this is one way, one form of assisted reproduction that we do. So the other times you also have ability to test for genetic abnormalities where you do pre-implantation genetic diagnosis, PGD, or pre-implantation genetic testing as the case may be, and then you may need to be able to test for certain abnormal traits that run in the family, or even for those who want to select a particular sex. So you can use, they exploit that opportunity to be able to see if they can get a particular sex they want. But of course, these are very expensive procedures. Okay, you have to check your pocket and be sure that you're ready to do that kind of thing. So this will be very much beneficial for people who are people who are AS, couples that are both AS and they are trying to avoid sickle cell baby. So you want to be able to take advantage of these advanced procedures to get exactly what you are looking for. These are some of the things that we offer in assisted reproductive technology. So Princess Medical Center or Princess Medical Clinic is well positioned to offer these world-class services to clients. Okay, so you should feel free to come to us and then we'll evaluate you and then know exactly what your needs are and be able to provide you world-class service. We have all the equipment, we have the staff, we have everything that we need to take off, and we are taking off immediately. So those who may have tried elsewhere and didn't get the result they expect, or those who haven't tried, those who want to know more, those who want to, try, you can come to us, visit us in the clinic, we'll see you, we'll evaluate you, and we'll be able to advise you. You see, there are even a lot of couples who are thinking of IVF. They haven't even been evaluated properly. You might be surprised that you may not even require IVF. You may require lesser treatment, to be able to achieve conception. So you need to be properly evaluated, and then what exactly we'll be able to know what form of treatment you exactly need to be able to achieve conception. We'll be offering you that. So we are well positioned to offer this wide range of treatments. You can also come for general gynecological consultation to be able to know what we need to do. Some who are coming may have problems that we may need to solve before we move on, to start assisted reproductive program for them. There are some who may be coming who have huge multiple uterine fibroids that we may need to operate, and prepare the womb before planning them for IVF. They may have other abnormalities of the genital tract that we may need to correct before we can proceed to start the program for them. So you may not know exactly what you need until you come, until you have been evaluated, until you have been investigated, and then you will now be given the proper advice on what form of assisted reproductive technology to seek. So I think I will be ready to welcome questions if there are any. And before we go for questions, you must understand that there are people who may have suffered damage to their womb, either through prior surgeries or maybe some pathology, growth in the uterus. There have been people, for instance, I have like a couple of clients who are battling with what we call adenomyosis. You just have the uterine endometrial tissue infiltrating and overtaking the entire uterine muscle. So that kind of uterus will not be able to carry a baby. So usually the treatment for it will be to remove the womb because the womb is not useful. It just gives them a lot of pain during their period and makes their flow to be very heavy. making the life of such women very, very distressing and reducing quality of life for them. So for such people, they may not be able to carry their own children, but we can offer surrogacy. You can explore, you know, the idea of surrogacy where you can have your genetic baby, okay, the product of your egg and your husband's being carried by another woman in her womb, and the baby is yours after delivery. So that's for those people who have abnormalities in their womb and they may not be able to carry their own children. You see, there is no condition you will have that there won't be solution. So you have to come. Until you come, you will not know that your case is not hopeless. You have to come first so we can evaluate you and we advise you accordingly.